In this video, I will give you all the information you need to ensure bottle feeding doesn't lead to a thrush infection for your baby. Learn how to keep your baby safe and healthy while still enjoying the convenience of bottle feeding. 1. What is thrush? Thrush is a common fungal infection caused by an overgrowth of yeast. It appears as white patches in the mouth, on the tongue, and throat, or it can affect other parts of the body such as the diaper area. 2. What are the symptoms of a baby with thrush? If your baby has thrush, you may notice white patches inside the cheeks, on the gums, or in the roof of their mouth. These patches may look like cottage cheese and can be painful for your baby to eat or drink. Other symptoms can include a sore throat, difficulty nursing, fussiness during feeds, and refusal to nurse. If you notice any of these signs, it's important that you seek medical advice right away. Your doctor will be able to diagnose thrush through a swab test and prescribe an antifungal medication to help clear it up quickly. 3. How can I tell if my baby has thrush? Thrush in babies can be difficult to identify. Common symptoms of thrush in babies include white patches on the tongue and inside of the cheeks, difficulty breastfeeding or bottle feeding, or fussy eating, refusal to feed, and irritability. If you suspect your baby has thrush, it is important to seek medical advice as soon as possible. Your doctor may recommend a swab test to confirm that your baby has thrush. Once confirmed, they will be able to advise you on what treatment is most appropriate for your baby. Treatment usually involves using an antifungal cream or gel directly in their mouths several times a day for 7 days. 4. How do babies get thrush from bottle feeding? Thrush is caused by a fungus called Candida albicans, which can live in the mouth, throat, and intestines of both babies and adults. Babies are more susceptible to catching this infection because their young immune systems are not yet fully developed. Bottle feeding is one of the most common ways for babies to become infected with thrush. This is because when bottles are shared between siblings or other family members, the fungus can be easily passed from one baby to another through saliva on the nipples or spouts of bottles. It can also be spread through bacteria that is left behind on bottle nipples after it has been washed without being sterilized. 5. What steps should I take to avoid giving my baby a thrush infection while bottle feeding? To avoid giving your baby a thrush infection while bottle feeding, it is important to always maintain cleanliness. Wash your hands before handling the bottles and nipples, and be sure to sterilize all equipment both before and after each use. Additionally, thoroughly wash any other items that come into contact with the bottles or nipples like bottle brushes or drying racks. To further minimize the risk of infection, consider using cold water instead of hot when cleaning bottles, and keep them from being left out for extended periods of time. 6. Are there any medical treatments available for treating a baby's thrush infection caused by bottle feeding? Yes, thrush infections caused by bottle feeding can be treated with antifungal medications, such as nystatin suspension or fluconazole. However, it's important to speak to your doctor before beginning any treatment plan. In some cases, your doctor may recommend a combination of treatments in order to ensure that the thrush is completely cleared up quickly and effectively. If you are breastfeeding, it's also important to get treatment for yourself in order to avoid passing the infection back and forth between you and your baby. It's also recommended that you clean all bottles, pacifiers, nipples, etc. after every use, and discard any unused formula after 24 hours in order to prevent reinfection from occurring. 7. Is it safe to continue bottle feeding after treating a baby's thrush infection caused by it? Yes, it is safe to continue bottle feeding after treating a baby's thrush infection caused by it. However, you should take extra care to ensure that the feeding bottles are properly cleaned and sterilized regularly to prevent further infections from happening. This can be done with either a cold water rinse followed by boiling for at least 5 minutes, or using a microwave sterilizer if available. Additionally, each part of the feeding equipment should be replaced as soon as possible. For instance, nipples and teats should be replaced after every 2 months. If your child continues to develop oral thrush despite preventive measures, consult your doctor for the correct treatment protocol. We hope this video has given you the information and resources to help prevent thrush in your baby. Remember, if you're bottle feeding, make sure to practice good hygiene habits like washing all bottles after each use and not overfilling them with formula or breast milk. If your baby starts showing signs of thrush, contact a pediatrician right away for treatment options. Be sure to leave us a comment below on how you keep thrush from developing when bottle feeding. Also, don't forget to subscribe so that you can stay up to date with our latest videos about parenting tips and tricks. Thanks for watching.